Hi, this is Mr. Hove from Bluefin Vision. Today's video explains the difference between cataract surgery and lens replacement surgery. So if we start off with cataract surgery is done because the natural crystalline lens in the eye has become cloudy and you're removing that cloudy lens to restore the ability of that eye to see normally. So cataract surgery is treating pathology or disease in the eye. Lens replacement surgery is doing much the same operation. You're removing the crystalline lens, you're replacing with a plastic lens, but the aim of lens replacement surgery is to get rid of the need for glasses or contact lenses. So the patients who are having lens replacement surgery can see normally with their glasses or contact lenses, but they're having surgery electively to stop needing to wear glasses or contact lenses. Whereas the patients with cataract, even with glasses or contact lenses, they cannot see properly and therefore they're needing the surgery to make them see better. So one's an operation to cure a disease and therefore it is covered by insurance if you have private medical insurance, and the other is an elective procedure to stop needing glasses or contact lenses and is not covered by insurance. I personally have had cataract surgery. I got cataracts because I developed a condition called uveitis, and uveitis is an inflammatory condition where the inflammation in the eyes needs to be treated with steroid drops, which I had to use almost continuously for 5 years, and therefore got cataracts related to the side effects as a use of the steroids. I then had cataract surgery to remove the cataract and had trifocal lenses put in my own eyes, and now I'm completely spectacle independent and I have better vision than I had before the cataract surgery. Thank you.